Hello, I'm Sylvia Forbes, UW-Milwaukee College of Nursing Distinguished Alumna, and along with Dr. Mary Jo Bache, are honored to be your Master of Ceremonies for this evening's celebration.
Good evening. We welcome you to the UWM College of Nursing's 55th Anniversary Distinguished Alumni Ceremony. For optimal viewing, we ask you to set your display to speaker view, and if you hover your mouse over the checkerboard in the right-hand corner, there will be a drop-down of gallery and speaker view. Click on the speaker view. The chat is open. We welcome you to share it for congratulations. And also, if you could please turn off your camera and remain muted for optimal viewing and connectivity for the rest of the program. Now, before we begin the celebration of the new distinguished alumni, I'd like to take a moment to honor the 50 distinguished alumni watching this evening's ceremony and recognize them along with all of the new honorees.
I would now like to introduce to you UW-Milwaukee's Chancellor, Dr. Mark Money.
Well, thank you, Sylvia, and thank you for emceeing along with Mary Jo. I'm honored and just wonderfully pleased to be able to help congratulate and kick off the 55th celebration, 55th annual celebration. What an accomplishment. This is tremendous. And what a distinguished group of honorees we'll be inducting tonight. It's really neat to see so many faces here. But now imagine if this screen were filled with 10,000 faces. That's how many alumni exist from the College of Nursing around the world. And what a huge impact you've all had. I have to say, it's the COVID vaccine clinics. It's the ways that you've been addressing so many interrelated health issues, poverty, gender-based violence, racial and other inequities, transcultural care, maternal infant outcomes, so many more issues all over the world in so many impactful ways. It's just incredibly impressive. In fact, I'm really hard pressed to think about any other field that has as much personal impact and how much meaning there is. And what you do makes all the difference in the world. I say that from personal experience. I'm a cancer survivor. And I know how helpful the medical technology is. I know how helpful the doctors have been. But I also, and most importantly, know it's the nurses, when it's the infusion bay, when it's the prep, when it's all of the treatments, the months and months and months, whether it's surgeries, radiation, chemo, nurses carry the brunt. So this is particularly incredible for me to be in a setting where there's not only remarkable women and men who are doing the healthcare provision, the types of things that nurses do day in, day out, but to have the biggest nursing program in the state of Wisconsin, the top ranked nursing program in the state of Wisconsin, it's just a point of pride. It's such a huge deal for this university and for all of you who have helped make this school and frankly, this campus what it is. And you know what? Others are noticing. We have recently been notified that our College of Nursing, which has historically been incredibly strong at the master's and doctoral level and has always been strong, we today are ranked in the top 11% of all bachelor's in nursing programs in the United States. That's out of almost 700 nursing programs. We're in the top 76, and we're in the top 10% of nursing programs with graduate programs. Now that's US News and World Report. What about the ranking in terms of top RN to BSN.com? We're in the top 25 of all RN to BSN programs across the country. This is pretty heady stuff, and that's what you've both graduated from and also helped make. So I really am honored to be with you tonight. I think this is a significant celebration. 55, you've got a ways to go to catch up with me. You're getting there. So you're really important. especially when I think about our campus as an engaged, a Carnegie engaged university. And there's not very many of those around. You should know there's not many more than 12% of the universities in this country that have that distinction. There's only 2.5% of the universities in this country that have the Carnegie Research One recognition. That's the level of research that we're at. And the nursing program is a big part of the engagement and of the research, as well as all the different community service and teaching, importantly. So you are so important because you do it every day, and you'll continue to have impact, not just on hundreds, but truly on thousands of individuals around the world. So congratulations once more on an incredible 55 years. And thank you for being such an important part of the UWM Panther family. Now it's my pleasure to introduce the UW-Milwaukee College of Nursing's Dean, Dr. Kim Litwack. She's going to share a few words, but before she does, I want to just shout out some of the incredible accomplishments that Kim has enabled us. I just rattled off some important statistics about what we have achieved. A lot of that has been built up over years, but Kim has really accelerated our impact. We received the only organizational recognition from the Milwaukee Business Journal as a community partner, healthcare community partner. It was Kim Litwack's leadership, and there was a huge team, but it was really her ability to engage not just our College of Nursing, but really a number of the other health units on our campus that Kim really corralled, helped bring together. And she epitomizes the phrase of, if you want something done, ask a nurse. She is absolutely amazing, and I'm really proud of her leadership, her accomplishments, her humility, and how quietly and effectively she just gets the job done. So Kim, I'm really, really pleased that this 55th anniversary is happening on your watch, and I'm really impressed with all the work that you do and the big difference that you've made. So with that, I hand it over to our Dean, Dr. Kim Litwack. Kim?
Thank you, Chancellor Mone. As we gather this evening in celebration of outstanding alumni, we also want to celebrate the 55 years that the College of Nursing has gone through. It's important to reflect on the college, the alumni, and faculty accomplishments as we have impacted policy and research and patient care. We've had some amazing accomplishments over this last year, and I'd like to share a few of them with you tonight. Our simulation center is finally moving forward. We thought we'd be able to ribbon cut in January, but apparently there's some cells that go into computers or computer chips that we can't get. They're sitting in a warehouse or a ship off of Los Angeles. But we will be opening that in 2022, and we invite you all to come see it once we officially can cut the ribbon. We hope by fall of 2022, our students will be in there. We also, this past fall, launched a cohort at Waukesha, expanding the reach of the College of Nursing, and we filled it within days of opening with 32 students, and that has been tremendously successful for us. We've started work on diversity, equity, and inclusion to move our students and our faculty forward to making our campus and our college more inclusive. We've had some big hits in research this last month with Dr. Michelle Pulfas and Dr. Lucy Makandawir-Valmu and Dr. Hyun Oh, all being funded we now have multi-million-dollar funding all coming in the last month, which is absolutely fantastic. Our enrollments are up. Our student affairs department knocked their socks off in terms of tracking down and following up with every student who applied to make our freshman class one of the largest we've had in a while. Before I hand this off to our MCs today, I would be remiss not to acknowledge and thank the Awards Selection Committee. I'd like to thank Dr. Lori Glass, Sylvia Forbes, Dr. Teresa Johnson, Dr. Shakur Lee, and Peggy Sampson. We couldn't have done it without them. And with that, I'd like to send it back to Mary Jo Beisch.
It is with my pleasure that we begin recognizing the UWM College of Nursing's 55th Anniversary Distinguished Alumni Award recipients. This group of honorees have and continue to impact communities through research, practice, and engagement. The work that this group has done to advance health and wellness through the nursing profession is truly remarkable, and is with great pleasure that I introduce you to the first honoree. Beth Peterman is a two-time alumna in the classes of 1974 and 2000.
Hello, I am Beth Peterman. It is an honor to be recognized and to receive the 2021 Distinguished Alumni Award from the UWM College of Nursing. Both my Bachelor of Science and Master of Science degrees were conferred at UWM in 1974 and 2000, respectively. My nursing career spanned almost 40 years, and my career afforded me opportunities nationally and internationally. I've enjoyed many professional successes and have grown as a person because of UWM and its influence in providing me a holistic nursing education. For this, and also the ability to effectively impart nursing care and to teach as a nurse, I'm forever grateful. Much of my career was spent in management positions, and although I've enjoyed many wonderful times in nursing, it's in my management roles that I remember two significant memories. First, my years as a nurse, providing care, managing nursing care in acute care and medical surgical settings. In the emergency department, I helped to educate some of the first EMTs in the city of Milwaukee. Then, on a 56-bed patient unit with a cardiac step-down component, I quickly learned the value of teamwork with my 66-member staff. I learned how to effectively communicate and educate both patients and staff, as well as to develop a greater appreciation for collaborative work, management, and leadership skills. The highlight of my career, though, was the 15 years I spent at the House of Peace Community Nursing Center as a practitioner and center director, educating students while providing primary health care and for people and teaching patients how to manage their health and well-being in community was enriching and enlightening. And as I became more knowledgeable about social justice and about how access to healthcare services impacts the health of the community, the nursing students grew in that knowledge as well. I saw changes in their approaches to caring for and educating people and their ability to embrace meaningful advocacy. UWM College of Nursing, you changed them as well in a positive way. Over the years, I grew as a nurse and I became a better person, someone who learned how to care about, advocate for, and embrace social justice in my work and on behalf of others. Thank you, UWM College of Nursing, for all you did for me and all you continue to do to strengthen and increase the nursing workforce.
And now I'd like to welcome Beth Peterman on screen for a few remarks.
Thank you, Mary Jo, and thank you, Chancellor Mone, as well as Dean Litwack and all the others that are present this evening. I'm humbled with this recognition and to be granted a place among such esteemed colleagues. I have been blessed with a wonderful nursing career and thank the UWM College of Nursing for making it all possible. Thank you too to my friends and family who are here tonight virtually. Thanks again.
Congratulations, Beth.
Thank
And next up is Margaret O. Schmelzer, the class of 1973.
Hello, my name is Margaret Schmelzer. I'm honored to receive the 2021 Distinguished Alumni Award from the UWM College of Nursing. I received my bachelor's degree from UWM in 1973, and in 1978, my master's of science degree in public health from the University of Minnesota. For 20 of my 44-year career, I served as the state public health nursing director and public health policy director in the Wisconsin Department of Health Services. Although I'm now retired, my career in public health has and continues to be dedicated to improving the nursing profession and strengthening public health system capacity to promote the health of the 5.8 million residents of Wisconsin and their communities. Although I have enjoyed many successes, 3 significant collaborative leadership accomplishments come to mind. First, the 1993 landmark revision of our public health laws and administrative rules. Second, the strengthening of the role, practice, and capacity of public health nursing at the local, state, and national levels. And third, setting the stage for our public health system's transformation through 2 legislatively mandated decennial state health plans. When it comes to UWM, the College of Nursing changed my life course and launched me into the profession I love. While there, I matured and learned the value of higher education. It taught me the importance of preparation, organization, and critical thinking. My education at UWM shaped my life's foundation. I developed lifelong friendships with UWM nurses, and we were a force at the Milwaukee Health Department, where UWM graduates dominated the nursing workforce. Equally important is what UWM did for my family. As a backdrop, my mother was a force when it came to higher education, especially when my father suddenly died and left her with 8 children to raise, ranging in age from 4 to 18 years. Faced with being a single parent of a large family with limited means, she was determined that her children would obtain college educations. As a result, 5 of us graduated with baccalaureate degrees from UWM. My mother herself was a secretary at the UWM School of Education. Like my brothers and sisters, my own daughters have multiple degrees in both architecture and nursing. My husband, a family physician, was always there supporting us, supporting women in higher education. So what does UWM mean to me? It means everything. It shaped my foundation and life course. UWM was always there for me and my family. It is a lasting legacy. Thank you so very much.
And thank you, Margaret. I'd like to now welcome Margaret Schmelzer on screen for a few remarks.
Hello. It's just a complete honor to receive the Distinguished Alumni Award for 2021. And as I said in the video, UWM has always been there for me, my family, and for many, many, many nurses who have followed in subsequent years. I just want to say that UWM, as an urban center, stands steady and sure for the Milwaukee community, our state, our nation, and beyond. It is a treasure and a lasting legacy. Thank you all so much.
Congratulations again, Margaret. Next up is Dr. Julia Sneathan, the PhD class of 1998.
I am Julia Sneathan, an alumni of the UWM College of Nursing class of 98. I have been a maternal child nurse in practice, and as an educator, I currently am a professor and the PhD program director in the College of Nursing. I would encourage students to consider the UWM College of Nursing because the College of Nursing is good at community building. I always felt like faculty cared about the students and provided an academically strong program. I had an excellent major professor who mentored me, not just during my doctoral program, but throughout my career. You know, I had so many resources in the College of Nursing. There were statisticians, there were librarians, faculty, and staff, always very supportive of students. You know, I always thought there was a feeling of welcome and belonging in this community called the College of Nursing. Students need a strong community during their education so that they can thrive. I would strongly encourage students to consider the UWM College of Nursing. One of my best memories of being a student at the UWM College of Nursing were the friendships that I made as I went through the program. As students, we were there for each other as we went through similar experiences, some challenges, and certainly others very encouraging. I developed friendships that literally lasted a lifetime, and they were foundational to my professional growth. Friendships are definitely one of my best memories of being a student at the UWM College of Nursing. The areas of my nursing career that have been the most impactful to me has always been the opportunity for me to see someone flourishing. the delivery of a healthy baby who is kicking and being held by its mom, or a child receiving a successful transplant and then running around the unit with all the energy that a kid needs to have. As an educator, seeing a student grow academically, increasing their knowledge, honing their skills, or engaging in scholarly discourse is very affirming to me. Seeing students providing support to each other and flourishing have all been impactful moments in my nursing career.
Thank you very much, Julie. And now I'd like to welcome her on screen for a few remarks.
Thank you. Receiving the UWM College of Nursing Distinguished Alumni Award is a great honor. I would like to thank the Chancellor Moni, Dean Litvak, and the College of Nursing, as well as the members of the Distinguished Awards Selection Committee for this recognition. As an alumnus of the College of Nursing, I have learned that no one accomplishes much by working alone, and neither have I. First and foremost, I would like to recognize the students that I have had the privilege to teach in the College of Nursing. I feel very blessed every day that I have the honor of working with students who are the best and brightest future nurses, clinicians, and researchers. I also need to acknowledge the amazing mentors that I have had, which started with my major professor here at UWM, Dr. Marion Broom. However, I've had many mentors within the faculty here at the UWM College of Nursing, including Dr. Florence Selder, Dr. Karen Marin, Dr. Teresa Johnson, Dr. Rachel Schiffman, Dr. Sandra Underwood, and Dr. Erin Bousset, who I dearly miss. All of my colleagues here in the College of Nursing must also be acknowledged, as they are a font of expertise, wisdom, and provide ongoing support to me on a daily basis. Finally, I never could have made this journey without my family, including my husband and children, and friends who have continually supported me, and in the words of Dr. Carol Porth, my master planner engineer. Thank you again for the UWM College of Nursing Distinguished Alumni Award.
Congratulations again, Julie. And next up is Dr. Maravik B. Torregosa, who is in the PhD class of 2011.
My name is Maravik Torregosa. I am currently the Dean of the College of Nursing and Health Sciences at Texas A&M International University here in Laredo, Texas. I completed my PhD in nursing at UWM in 2011. The areas of my nursing career that I think are most impactful are through my current involvement and efforts in student mentoring, through undergraduate research activities, managing programmatic grants that help address the needs of the community, such as building the capacity of sexual assault nurse examiners or SANEs in the region, and programs that promote academic success among young Hispanic adults through substance use prevention, stress management, and mental health. I would like to think that my work through funded programs has somehow helped address the health disparities in the region by increasing the capacity of healthcare professionals and through programs that help address the health needs of the community. The years I had at UWM shaped me as a nursing professional. I wrote and won my first competitive research grant when I was a doctoral student. That was an eye-opening for me. It helped me understand the amount of work that it takes to write and submit a competitive grant proposal. Having gone through the experience helped me develop patience, tenacity, discipline, and humility to collaborate with people outside my discipline. Those experiences helped me get to this point of my career. One of the most memorable moments in my career that I am most proud of was when I won my first research grant proposal as a doctoral student at UWM, which funded my dissertation. I then published several papers from that dissertation, which helped me with my application for promotion and tenure. The other moment was when I mentored and co-authored papers with my undergraduate students, and seeing them now that they have successfully completed their graduate degrees are memorable and valuable moments to me. My memory of UWM is that I was fortunate to have professors and my mentors like Dr. Morin and Dr. Schiffman who were focused on the success of their students. Because of the faculty support and mentoring I received at UWM, I encourage all my nursing faculty and all nurses who want to pursue a doctoral degree in nursing to enroll at UWM. Thank you.
And now I'd like to welcome Dr. Taragosa on screen for a few remarks.
Good evening. I am deeply honored to be selected as one of the distinguished alumni of UWM College of Nursing, knowing that the institution has graduated so many nurses that are making a mark in the field of nursing. I am forever grateful to the nursing faculty, especially my mentors, Dr. Morin, Dr. Schiffman, Dr. Marcus and Alvis, who are members of my dissertation committee. Working under their mentorship has greatly impacted my success in the program and my career trajectory after graduating from UWM. Thank you very much, and I am forever grateful to the university and my mentors.
Congratulations again, Maravik. And last of our distinguished alumni awardees is Dr. Julie Willems Van Dyke, the PhD class of 2008.
Hello, my name is Julie Willems Van Dyke, and I'm coming to you from my home office, where many of you may have seen me do media interviews during the COVID-19 pandemic in my role as Deputy Secretary and State Health Officer for the Wisconsin Department of Health Services. When I became the first nurse to assume the office of Deputy Secretary, little did I know that I would be leading the state's response to the largest pandemic in the last 100 years. It has certainly been the most memorable time in my nursing career. My PhD studies at UW-Milwaukee prepared me for this role through my studies of health policy, data, and my theoretical framework of my dissertation, the Evans and Stoddard Social Determinants of Health model. This model illustrates that far more than access to health care determine our health. Which brings me back to the pandemic. The social determinants of health drove the inequities we saw in COVID-19. People who had essential but low-paying jobs, lived in crowded housing, or had lack of access to health care were far more likely to contract the disease and die from it. As nurses, we must attend to the social determinants of health. And that is exactly why I can recommend students to consider UWM College of Nursing. It is a place that is working to diversify our nursing workforce, that is focused on health equity, and that is committed to access to education. I am extremely grateful to the College of Nursing for their leadership in innovation that allowed me to participate in the first online PhD program and complete my doctoral studies from Wausau. Thank you for this great honor, and keep up the great work, UWM College of Nursing.
And I would like to welcome Dr. Julie Willems Van Dyke on screen for a few remarks.
Thank you, Dr. Beige. Thank you so much for this incredible honor to the UWM College of Nursing, Chancellor Mone, Dean Litwack, the faculty and staff. I am so appreciative of your selection of me. You know, one of my nursing heroes is Lillian Wald. She's the founder of public health nursing in the US, a privileged woman who went into the tenements of New York City and served immigrant women in their homes when she saw them dying prematurely from childbirth, terrible maternal death rates, terrible infant mortality rates. And she went on to address many, many social justice issues through her career to address what we would now call health equity. One of Lillian's quotes is that nursing is love in action. And that is what you have all given me, is to understand that my career has been love in action. And I think that's what you've seen of each of the awardees tonight. So thank you so much for this honor. And may we all lead with love to improve the health and well-being of the people and communities we serve. Thank you so much.
Congratulations, Julie. Wow, what an incredible group of alumni you all are. On behalf of all the distinguished alumni, we congratulate you on your accomplishments and because your impact reaches far, and we are so proud of all of you. And now it's time to turn it over to my co-MC, Sylvia Forbes.
Thank you, Mary Jo. I too would like to extend my personal congratulations to each of you. Your influence and service is amazing. It is now my honor to recognize the Pioneer Awardees. The UWM College of Nursing Pioneer Award is given to recognize alumni who were the first in their expertise in the area of nursing research, clinical practice, education, or community impact. Our first Pioneer Awardee is Melissa Brown, class of 2001. Melissa is an expert in the field of nursing informatics. In 2010, she began leading the implementation of EPIC at all Advocate Aurora hospitals in the state of Wisconsin. In early 2021, Advocate Aurora partnered with the UW system to deliver COVID vaccinations at 2 of its universities. Melissa led the team who opened the mass vaccination clinics at UW-Milwaukee and UW-Oshkosh.
Hello everyone, my name is Melissa Brown and I am currently the Director of EMR Partnership Implementation and Operations at Advocate Aurora Health. I'm proud to say that my 20-year career has been with the same organization, and it started right out of the doors of the UWM School of Nursing. The area of my nursing career that has impacted me the most, I think, was when I was a preceptor. Having the ability to help shape and grow our new nurses was just so important. And just really gave me a sense of pride in what I was doing. And, you know, now watching them all grown into their careers, it's just really fun to see, you know, where they came from and where they are today. I would say my work with the COVID clinic has contributed most to the communities that we serve. In the last year, we did set up 2 COVID clinics, one at UW-Oshkosh and one at UW-Milwaukee, with collaboration with the University of Wisconsin schools. And just being able to give back to our communities and do something bigger than ourselves, I think was just an amazing opportunity. And I think, you know, just seeing the ripple effect that these thousands of vaccines have done for our communities and have helped keep our communities healthier is just amazing. Finally, I would encourage anyone who's interested in becoming a future nurse to truly consider the University of Wisconsin-Milwaukee. You know, I moved down here from a small town on the west side of Wisconsin, and I truly feel I would not have gotten the opportunities that I did anywhere else but at UW-Milwaukee. The leaders and the teachers and the professors were true professionals, and they had a love of nursing that you could feel and see every day. So if you're interested at all, UW-Milwaukee is the place for you.
At this time, I would like to invite Melissa Ann Brown on screen to share a few remarks.
Hello, everyone, and thank you, Dr. Forbes. I just want to start by saying that I am so incredibly humbled and grateful to be in this class of women that you've seen and that we've heard about tonight. It's just truly extraordinary, your accomplishments, and to be even on stage with you is very humbling for me. I think Dr. Sneathan said, you know, we don't do this alone. So, you know, I really want to thank my friends and my family who have been at my side and always supported this journey, whether it be nursing or informatics or going back for my master's, or they've always been there for me. So a huge thank you. And I'd also like to thank Advocate Aurora. I mean, I've spent my 20-year career there, and I've had so many amazing opportunities that I just wouldn't have gotten anywhere else. So just a huge thank you for helping grow me as a nurse and as a leader. And then finally, it all started at UWM and the College of Nursing. So, thank you to my professors, to the university for helping me build that foundation. And, I want to give a shout out myself to Dr. Litwack, a huge partner with us in these vaccination clinics. And, UWM is truly blessed to have her as a leader there. So thank you to everyone who helped us there. And I'm just so grateful. Thank you so much.
Congratulations, Melissa, on this recognition. Next is Dr. Jessica Kastner, PhD class of 2012. Dr. Kastner is an international expert in emergency and environmental health nursing. Her research has driven policy on multi-level environmental determinants of health, advanced data science, and emergency health outcomes.
Hello, my name is Jessica Kastner. I'm so honored to be here with you and the other awarded recipients. Thank you so much. I'm a PhD prepared nurse scientist with a clinical background as a board certified emergency nurse. I am currently the 21-22 National Academy of Medicine Distinguished Nurse Scholar, the editor-in-chief of the Journal of Emergency Nursing, and the principal and president of my startup research company, Kastner Incorporated, which serves a need for a nursing lens on advanced data and analytics, scientific dissemination, and organizational development and change. How did my work contribute to the communities that I serve? I identify and test policy and clinical interventions for healthier environments, whether that's environment, the air we breathe, the indoor air of a home of a patient with asthma, or the work environment for nurses or other occupations. How did UW-Milwaukee shape me as a professional? My first call to see if I was interested in the program was answered by Dr. Karen Morin. And it just stood out to me that she was so enthusiastic about my ideas and my contribution. And it was definitely a learning culture that just surrounded me with support. And I think that not only shaped my educational journey, but also my ongoing research and professional life in my collaborations. Why would I encourage a student to consider UWM College of Nursing? Most places can recruit diverse faculty and students, but UWM was really unique and special in supporting students from a wide range of walks of life who had overcome all kinds of barriers. So there was diversity support once you were there through the process and the educational journey and beyond. Thank you again.
At this time, I'd like to invite Jessica Kastner on screen to share a few remarks.
Thank you so much, Dr. Forbes. A special thank you to Chancellor Moni, Dean Litwack, the Awards Committee, and the staff. Your pride, time, and care are evident in this ceremony tonight. I want to thank my family and my support network. I could not have accomplished the PhD and all of the other accomplishments without your love and support. It is such an honor to be recognized by those I hold in such high esteem, who shaped my thinking, to question assumptions, to imagine and innovate, and not accept self-imposed limits. I could name every faculty member in my coursework in my PhD program as transformative guides, but I want to give a special shout out for those who invested in me in my dissertation committee: Sudeen Bar, Rachel Schiffman, Julie Dormandy, and Masoud Adkari. It is such a gift to celebrate here with you tonight. Thank you. Back to you, Dr. Forbes.
Well, congratulations, Dr. Kastner, on your achievements and your important work. Our next Pioneer awardee is Cheryl Ann Soretto, class of 2000. Cheryl's career since 1978 has focused on cardiac electrophysiology, alongside with her team of physicians, RNs, and others. Cheryl's impact can be seen in patient education booklets, bi-weekly patient support groups, and mentorship of many staff members across the state.
Hi, I'm Cheryl Soretto, RN, MSN, CCDS, Certified Cardiac Device Specialist. I'm an electrophysiology nurse and have been for 43 years. My education began in 1976 when I earned a diploma from Milwaukee County General Hospital School of Nursing. Next, I went for my bachelor's degree in nursing at Marquette University and graduated in 1986. Last, I earned my master's degree at the University of Milwaukee School of Nursing in 2000. I started electrophysiology, my specialty, with Dr. Akhtar. He came to Milwaukee in the 1970s, and he was considered one of the preeminent EP physicians in the world, a mentor to many and brilliant innovator and researcher. He included nurses in the care of the patients, in the research, in the publishing, and I was included in writing and presenting at American Heart Association, Heart Rhythm Society, and many other conferences. He and Dr. Sra were both professors of medicine at the UW-Milwaukee Medical School, and their support for all levels of EP was amazing. EP was experiencing explosive growth since its inception in 1967, and I was fortunate to join in on the exciting journey for 43 years. I just retired in February this year, and I reflect over the past years, especially at the University of Wisconsin School of Nursing. I remember the diversity, I remember the spirit, and I remember the culture that was fresh and inclusive, and it made the days that I went to school there more challenging, and I believe that it also prepared who I became, which was a more effective and confident caregiver, leader, and educator. It also made our team make a difference in the history and the advancement of diagnosis and care of patients with arrhythmias. Even though I am retired, I continue to volunteer giving injections for the COVID vaccination. I would like to acknowledge all of my mentors, my coworkers and friends, my patients, who, without them, this journey would not be the same. They are a part of the story, and I thank you and share this with them for the acknowledgement that you have given to us. Thank you so much. I am honored and humbled to be here tonight. It's such a grateful feeling to be a recipient of the Pioneer Award. I'm dedicating this award to the many people that I've worked with, the nurses, the physicians, my patients, my husband who has always had my back, my family, and so many other people in my life. Who knew that when we started in this practice that it would be a new medical specialty, which did not happen very often, and that after all these years we've stuck with it as a group and have made a difference. Currently, 37,500 million people worldwide have atrial fibrillation, and over the past 20 years, that has been an increase of 33%. So we will probably see all of you very soon. The UWM School of Nursing continues to exemplify the qualities I carried with me through my nursing and personal life, and it has given me more of a direction to believe in and spread amongst other people for the diversity and the spirit that the school taught me. I dedicate this award to Doris Vandervoort, my mom. She was a nurse for over 45 years, and she showed me her example of dedication and professionalism, which strengthened my confidence to be able to become a nurse and work as hard as she did. I always use Mother Teresa's words, and I do to this day in everything I do. Not all of us can do great things, but we can do small things with great love. Thank you so much.
Congratulations again, Cheryl, on this award.
Thank you.
Yes. On behalf of all UWM College of Nursing alumni, faculty, and staff, we want to congratulate all of you on your accomplishments. Colleagues, friends, family, feel free to share any additional congratulations in the chat now. I know some of you have already put your congrats in the chat. Now is the time to really go wild and show your support for these distinguished alumni and pioneers in nursing. Okay, I see some chat. I see some chats coming through. So thank you so much. So keep it going, and I'm just going to introduce our next speaker. At this time, I'd like to introduce to you Michelle Weinschrott, UWM College of Nursing Director of Development.
Hello, everyone, and thank you so much for the introduction, Sylvia. I'm delighted to be here with all of you today. And as a member of UWM's College of Nursing, I am consistently astounded by the outstanding impact our alumni have worldwide. I'm here with you today to announce that thanks to a very generous donor, we are launching the UWM College of Nursing Alumni Scholarship Fund with a goal to raise $55,000 in honor of our 55th anniversary celebration. As you probably know, scholarships are the lifeblood of our college, and our students need your support now more than ever, since more than half of our nursing undergraduates receive no financial support from their families, and half of all new freshmen are first-generation students. We invite you to consider a gift to our new Alumni Scholarship Fund to help support the next generation of UWM nurses. An email will go out to all alumni in the coming weeks announcing this wonderful opportunity to give back to your alma mater. I'd like to give my congratulations to all of you today. And now I'd like to hand the mic back to Sylvia. Oh, actually, I'm handing it back to Mary Jo. Sorry about that.
Okay.
Thank you.
Thank you, Michelle, for that wonderful announcement. We all know students need as much financial and academic support as we can provide. And this sounds like a wonderful way to make a difference for all of these students. Fellow alumni, family, and friends, I want to now leave you with a brief message from Wisconsin's most famous comedian, Charlie Behrens, otherwise known as the Manitowoc Minute, who sent in a brief message specifically for our event. We can all use a few laughs these days, and we know laughter can sometimes be the best medicine.
Oh, hey there, UW-Milwaukee College of Nursing. How in the heck are you? It's me, Charlie, host of the Manitowoc Minute. And I want to congratulate each and every one of you on being part of an institution that is now celebrating 55 amazing years doing great work in Milwaukee and Wisconsin and across the world. Gee squeeze, I can't talk. You know, that's why you don't drink brandy before 10 a.m. That's my medical advice for all you. Anywho, I do want to thank all of you for all the hard work you put in, over the past year and a half with the gosh darn COVID and whatnot. Honest to Pete, I know some of you have been working extra hours. Some of you came out of retirement to help. And honest to Pete, is it getting dusty in here or what? Why are my eyes sweating? No, sincerely, thank you for all that you've done, okay? So I want you all to keep her moving. And while you keep her moving, watch out for deer. And if you don't think a deer can run through an ER, well, then you haven't been working up in Rhinelander, okay? So honest to Pete, that happens. You got to know what to do. But you all know what to do, okay? You're nurses, and gosh bless you, and thank you for being you, okay? All right, I got to go. Hey, tell your folks I says hi, okay? And if any of you want some rhubarb from my freezer, I did it in the freezer bag so you can make, pies or bread or whatever. I got a good recipe. Canned tomatoes, I got 2. You bet your tush. And while you're in the garage, if you do want some of that venison, I got extra. Okie dokes, real good. Hey, if you find a deer in your ER, let me know. I'll come pick it up. Okay, real good. Bye-bye.
Thank you, Charlie, for bringing some levity to our evening. And with that, I'd like to again congratulate our 8 awardees and thank each of you for virtually attending to celebrate the wonderful careers and accomplishments of these alumni. Would each of you please change your viewing mode to gallery view in the top right corner of your Zoom application? Because at this time, We'd like all awardees to please turn on your cameras and wave goodbye to your colleagues, fellow alumni, family, and friends. So again, thank you all. Thank you again. And I wish all of you a wonderful evening.